Today, we will be learning about the country of Sweden. We will investigate its unique healthcare system, how it ranks and compares to the United States, as well as discussing health disparities among both countries. Sweden, a Scandinavian country with a population of almost 9.5 million, is located in Northern Europe between Norway and Finland. In this constitutional monarchy, the life expectancy is 81 for males and 84 for females, about 3 to 5 years higher than the United States. Sweden has a socially responsible, decentralized healthcare system, meaning that it is mainly a tax-funded and financed program under the jurisdiction of its 21 county-like municipalities. Sweden spends approximately 11% of their GDP to finance healthcare, whereas the United States is closer to 18%. Sweden passed the Health and Medical Services Act of 1982, ensuring that everyone living in Sweden has access to good healthcare. So, who is covered? Everyone, to be exact. Sweden provides a universal care package that does not have defined benefits, but the whole continuum of care, from primary care to outpatient, is included. This includes mental health, prescription drugs, and even dental care is fully included up to age 23.
Every healthcare system is going to have its disparities, and Sweden is no exception to this rule. In 2019, a report known as the Open Comparisons in Public Health, or OCPH, was administered in Sweden, which was a longitudinal indicator-based comparative study that encompassed 39 public health indicators. The 39 indicators of the survey asked about health outcomes, social and living conditions, and lifestyle habits. Social conditions included socioeconomic factors such as education and work and occupation, while living conditions relate to the living environment, recreation, a sense of being able to influence your situation, and levels of security and trust. Living conditions are affected by social conditions. Lifestyle habits relate to everyday behaviors that are often affected by social conditions and living conditions. Using the data from the OCPH, a recent study published in 2019 looked at health disparities based on neighborhood and social conditions in Sweden. Using the data, researchers went on to trend and compare health disparities based on the reported neighborhood and social conditions. Results from the study found significant health disparities remain according to neighborhood, sex, age, and educational background. Health disparities related to the level of education were found to be larger than those between women and men, and there were larger differences within a region than between regions. Additional findings suggested health disparities have, in some cases, increased, such as for life expectancy. Researchers also found that a higher socioeconomic status led to a higher self-rated view of health in both men and women. A study published in the Scandinavian Journal of Public Health highlighted two aspects of health inequalities: life expectancy at age 30 and its relation to an individual's educational level. Data showed there is a gradient in life expectancy, with a stepwise increase in life expectancy from those with basic education to those with tertiary education of 3 years or longer. As you can see, there is a difference in remaining life expectancy of 6 years between those with basic education and those with at least 3 years of university education for men and women alike. Researchers found individuals with no registered education had a life expectancy 9 to 10 years lower than among those with basic education.
Now we'll discuss U.S. healthcare and its disparities.
Rather than operating a national health service, a single-payer national health insurance system, or a multi-payer universal health insurance fund, the U.S. healthcare system can best be described as a hybrid system. It is a mix of public and private, for-profit and non-profit insurers and healthcare providers. The federal government provides funding for the National Medicare Program for adults 65 and older and some people with disabilities, as well as for various programs for veterans and low-income people, including Medicaid and the Children's Health Insurance Program. States manage and pay for aspects of local coverage and the safety net. Private insurance, the dominant form of coverage, is provided primarily by employers. The uninsured rate of 8.5% of the population is down from 16% in 2010, which is the year the landmark Affordable Care Act, otherwise known as the ACA, became law. Public and private insurers set their own benefit packages and cost-sharing structures within federal and state regulations. While Sweden has 100% of their population covered by national insurance providing automatic coverage, 91.5% of the United States population are under any type of public or private insurance, with private being the most common. There is no universal health care in the U.S. Nearly 92% of the population was estimated to have coverage in 2018, leaving 27.5 million people, or 8.5% of the population, uninsured. Movement towards securing the right to health care has been incremental. Healthcare in the U.S. is expensive, with the out-of-pocket maximum limit reaching up to $7,150 for an individual and $14,000 for a family in 2017. These amounts do not include the monthly premiums each individual is responsible for paying. Doctors in the two countries also face different financial incentives. In the United States, under the fee-for-service model, they can bolster their incomes, often substantially, by prescribing additional tests and procedures. Most Swedish doctors, as salaried employees, have no comparable incentive. At present, the U.S. healthcare system is of vital interest to the nation's economy and government policy. The U.S. healthcare system is characterized as the world's most expensive, yet least effective compared with other nations. Growing healthcare costs have made millions of citizens vulnerable. Major drivers of the healthcare costs are institutionalized medical practices and reimbursement policies, technology-induced costs, and consumer behavior.
The first disparity to be compared among the two countries is an infant mortality rate. Infant mortality rate is looked at as an indicator for the health of a nation because it compares maternal health, quality and access to medical care, socioeconomic conditions, and public health practice. The United States ranks at 26 among the 29 OECD countries, and it has infant mortality rate of 6.1%. Sweden ranks at 2.5%. The second disparity to be studied is obesity. United States ranks first in the prevalence of obesity, with both males and female equally ranging to 30.6% of the population classified as obese. Sweden has a greater prevalence of men than females and ranks at 9.7% of the population. The third disparity to be studied is gender, specifically focusing on the LGBTQ community. Looking at the LGBTQ+ Danger Index, which ranks 150 countries as the most safe or worst countries to travel to, United States ranks 127. Sweden, however, ranks first as the most safe country to travel to. As of June 12th, Trump administration erased transgender civil rights protection in healthcare, which basically states that doctors are now free to turn away patients due to their gender. The fourth disparity is disability insurance, which is applied for when a person is no longer able to work due to a medical condition and can receive a monthly stipend. In Sweden, 20% of the population who applied for work disability, the full 20% was able to receive a disability insurance. However, in the United States, 27% of the population who applied for a work disability, only 13% was able to receive a disability insurance. The last disparity is multiple chronic conditions, which are two or more chronic conditions that affect a person at the same time. In the United States, 28% of the population are affected with MCC, compared to Sweden, who's at only 18%. The increase in rate in the United States compared to Sweden could be due to the cost of health care and services and the specific guidelines that have to be followed. For example, home health, nutrition, mental health, and physical therapy may not be covered by some insurances in the United States.